Hi everyone, and welcome to our module on study designs. Let's start by talking about epidemiology studies. So epidemiology studies are studies of populations of patients, and they examine the association between an exposure and a disease. And there are many real-world examples of how epidemiology studies have helped us over the years in medicine. For example, from epidemiology studies, we know that patients who have hypertension, which is a form of exposure, are at a higher risk of stroke. We also know from studying populations that smoking is associated with a higher risk of lung cancer, or that toxic waste is associated with a higher risk of leukemia. And so the way we link these exposures and outcomes like disease is by studying populations and seeing who gets disease relative to who has the exposure. And it's important to appreciate that epidemiology studies are different from clinical or research studies. And the main way they're different is that in an epidemiology study, you have no control over exposure. You simply study a population and examine the people who are exposed and those who are not, but you can't control who is exposed. And this is very different from a clinical or research study like a clinical trial, where researchers control the exposure and they assign some patients to, for example, exposure to a drug and other patients to no exposure. You do not have control over exposure in epidemiology studies. So there are three main types of epidemiology studies that are used to determine the association between an exposure and a disease. Those three types of studies are a cross-sectional study, a cohort study, which can be prospective or retrospective, and a case control study. And we'll go through each of these one at a time in the next few slides. The simplest type of epidemiology study to understand is a cross-sectional study, also known as a prevalence study. In cross-sectional studies, the patients and the individuals you're going to study are identified because they're part of a group. For example, you could study New Yorkers or women or tall people. But the key point is that you're identifying them because they're part of a group, not because they have or do not have a disease or because they have or do not have an exposure. Once you've selected the group you're going to study, you identify the frequency of disease and risk factors at the same time. And this is an important point. If you were to identify individuals with disease and then watch to see how many of them were exposed to something, that would be a different type of study. But in a cross-sectional study, you evaluate disease and risk factors or exposure at the same time. So for example, in a cross-sectional study, you might look at how many New Yorkers have lung cancer and how many smoke. Both the exposure and the outcome are being evaluated simultaneously among a group of people. Also important is that cross-sectional studies are simply a snapshot in time. Patients and individuals are not followed for months or years. That happens in other types of studies we'll describe later. And then the main outcome of a cross-sectional study is prevalence. That's why they are called prevalence studies. So for example, a cross-sectional study might determine that 50% of New Yorkers smoke and 25% of New Yorkers have lung cancer. It's simply identifying the prevalence of the disease and the exposure, which is smoking, at a snapshot in time. The major advantage of cross-sectional studies is that they're easy and quick to perform. You simply identify the group and then you evaluate the exposure and the outcome. You don't need to follow individuals over time for years and years. You should also be aware that a cross-sectional study can have more than one group. So for example, a study might find that 50% of men have lung cancer and 25% of women have lung cancer. This is still a cross-sectional study because the groups are not followed over time like years. It's just a snapshot in time identifying the prevalence of lung cancer in different groups. The major disadvantage of a cross-sectional study is that you can't determine a causal relationship. Since it's only a snapshot in time, you can't determine how much smoking increases the risk of lung cancer over time. This is called a risk ratio, which we'll talk about later. You also can't determine the odds of getting lung cancer in smokers versus non-smokers. This is called an odds ratio, which we'll also talk about later. But both of these things require following individuals and patients over time to see who gets disease and who does not. So on your board exams, they will often describe a study and ask you to identify the study type. So let's talk about how you can identify a cross-sectional study based on a description. So let's imagine New Yorkers are surveyed to determine whether they smoke and whether they have a morning cough. The study finds a smoking prevalence of 50%. Among responders, 25% reported a morning cough. So first of all, notice the use of the word prevalence in describing the study. That's often a tip-off that they're talking about a cross-sectional study, also known as a prevalence study. Notice also the absence of a time period. The patients are not followed for a year or 2 years or 5 years, and that also usually indicates a cross-sectional study, which is a snapshot in time. So likely questions about this type of study are what type is it, and the answer is a cross-sectional, and what can be determined, prevalence of disease, not incidence of disease. Those things require extended periods of time following patients. Here's another example. Using a national U.S. database, rates of lung cancer are determined among New Yorkers, Texans, and Californians. Lung cancer prevalence was 25% in New York, 30% in Texas, and 20% in California. The researchers concluded that living in Texas is associated with higher rates of lung cancer. So because there are different groups, this can make you think of other study types, but notice that there is a lack of a time frame. They're simply doing a snapshot in time to see how much disease is present in the different locations. This is really just a fancy description of disease prevalence, nothing more, and once again the word prevalence is even used in the case description. And then here's a final example. Researchers discover a gene that they believe leads to the development of diabetes. A sample of 1,000 patients is randomly selected. All patients are screened for the gene. Presence or absence of diabetes is determined from a patient questionnaire. It is determined that the gene is strongly associated with diabetes. So once again, notice the lack of time frame. This is just a snapshot in time of 1,000 patients and whether or not they have the gene or have disease. Notice also that selection of the patients is random. They're not selecting patients because they have diabetes, the disease, or because they have the gene that would be selecting them for the exposure. We'll talk about this shortly, but selecting patients for presence of disease or exposure is the way that other types of epidemiology studies are done. In cross-sectional studies, patients are identified by being part of a group. In this case, they're just random patients that they've selected. And once again, as I said before, this is just a snapshot in time, and therefore it's an example of a cross-sectional study. Somewhat related to a cross-sectional study is a case series. This is also a purely descriptive study similar to a cross-sectional study, and it's often used when new diseases emerge that have an unclear cause. The idea behind a case series is to take multiple cases of a condition and combine them for analysis. And by looking at multiple cases together, you can study patient demographics like age and gender, and also symptoms and other features of the disorder. The idea is to identify clues about etiology by looking at the cases clustered together. And there's no control group, so this isn't a study where you're comparing one group to another. It's just a descriptive study of multiple cases pooled together. So sometimes you'll hear the term used, descriptive studies, and these are referring to studies that simply describe what's going on at a moment in time. They don't evaluate individuals over a period of time to see what happens to them. So a case report where you describe an interesting case of disease is an example of a descriptive study. It's just a description of the case. A case series is also a descriptive study, and so is a cross-sectional study. So now let's move ahead and talk about another type of epidemiology study, and we'll talk about cohort studies, which are also known as incidence studies. In a cohort study, you compare a group with exposure to a group without exposure, and then you monitor the group over time to see who develops disease or who develops the outcome of interest. Importantly, exposure is always determined before the outcome is known, and what you're looking for in a cohort study is, did exposure change the likelihood of disease? Cohort studies can be prospective, where they monitor groups over time going forward. They can also sometimes be retrospective, where you look backward in time at the groups, and I'll talk more about this later. Cohort studies are usually done for common diseases like diabetes, and that's because it's easy to find cases of the disease in different groups. If the disease were rare, cohort studies are hard to conduct because you can't find individuals who have the disease. And cohort studies are called incidence studies because you can determine the incidence of disease in groups. So let's imagine we wanted to know the association between obesity, that would be our exposure, and diabetes, that would be our outcome. In a cohort study, we'd identify a cohort of patients and divide them into those who are obese, that would be the exposed group, and those who are not obese, that would be the unexposed group. And then in each group, we would look at how many patients developed diabetes, which is the disease or outcome, and who did not develop diabetes. And we'd look at the differences between the onset of disease between the exposed and the unexposed group. The main outcome measure in a cohort study is a relative risk or risk ratio. This is a description of how much exposure increases the risk of disease. So for example, in a cohort study that evaluated smokers, it might find that 50% of smokers get lung cancer within 5 years, and 10% of non-smokers get lung cancer within 5 years. This would give a relative risk of 50 over 10 or 5, and this tells you that smokers are 5 times more likely to get lung cancer compared to non-smokers. So once again, let's go through some examples of descriptions of cohort studies so you can learn how to recognize these in board questions. So let's imagine a group of 100 New Yorkers who smoke are identified based on a screening questionnaire at a local hospital. These patients are compared to another group that reports no smoking. Both groups receive follow-up surveys asking about the development of lung cancer annually for the next 3 years. The incidence of lung cancer was 25% among smokers and 5% among non-smokers. So pay close attention to how the patients being studied are identified. They're being identified because they smoke. That's an exposure or a risk factor. So that's how cohort studies work. Patients are identified by the exposure, not by the disease. If the patients were identified because they had lung cancer, that would be another type of study. Notice also that it's not just a snapshot in time, it follows them over 3 years, and it can determine the incidence of disease. That's why cohort studies are called incidence studies. So likely questions are, what type of study is this? It's a prospective cohort study, and what can be determined as a... Here's another example of 100 New Yorkers who smoke, who are identified by a screening questionnaire. They're compared to another group that reports no smoking. Hospital records are analyzed going back 5 years for all patients. The incidence of lung cancer over that 5-year period is 25% among smokers and 5% among non-smokers. Once again, notice that the population being studied is identified by the fact that they smoke. That's the exposure or risk factor, and that's what makes this a cohort study. The difference between this and the last slide is that we're going backwards in time over 5 years to see who develops lung cancer. So this is a retrospective cohort study, but once again, you can determine a relative risk. You can also determine the incidence of disease in a study like this. Let me make an aside on retrospective cohort studies. These are often challenging to identify in board questions. It can be especially difficult to distinguish a retrospective cohort study from a cross-sectional study. And the reason this is the case is because in both types of studies, the study may describe individuals identified over a period of time, like over a 5-year period. When you see a time period, you will want to think it's a cohort study and not a cross-sectional study, but that's not always the case. But key things to remember are that in a cross-sectional study, the outcome is prevalence of disease. So a study that describes how many patients at a clinic over a 5-year period have hypertension, they're describing the prevalence of hypertension in that clinic over a 5-year period, and that's likely to be a cross-sectional study. On the other hand, a retrospective cohort study is going to have an outcome that's an incidence of disease. So first of all, the study will describe that they identified patients by exposure to the risk factor, for example, smoking. And then the study will also describe how many patients with that exposure developed hypertension over 5 years. They're talking about the onset of disease, the incidence of disease here, and therefore this is likely describing a retrospective cohort study. The major disadvantage of cohort studies is that they don't work with rare diseases. So let's imagine we identified a cohort of 100 smokers and 100 non-smokers, and we followed them over 1 year. In this time frame, there might be no cases of lung cancer because lung cancer is uncommon. So to do a cohort study for a rare disease, you need lots of patients over a long time, and this often makes it impossible to conduct these studies. An easier way to do studies of rare diseases is to find cases of the rare disease, for example, find cases of lung cancer, and then compare those cases to controls who are patients who do not have lung cancer and see whether the exposure to a risk factor like smoking is different between those two groups. So the type of study I'm describing is called a case control study. It compares a group of patients with disease to a group that does not have disease, and the group without disease is called the control group. And then once you identify the two groups, you look retrospectively backwards in time for exposure or risk factors. So this is the opposite of a cohort study. We're identifying patients by disease in this case and not by exposure, and then we're looking backwards in time to see the exposure in the disease and the control patients. But as I said in the last slide, this is the better study design for rare diseases. So here's a diagram of how a case control study might work. You start by identifying patients with disease, those are the cases, and then you identify a group of similar patients who do not have disease, those are the controls. You then evaluate the exposure within the control group versus the exposure in the cases group, and then you compare the rates of exposure. And if the exposure is associated with the disease, you expect to see more exposure in the disease group and less exposure in the no disease group. A key point about a case control study is that patients are not followed over time for the onset of disease, so you can't determine the incidence of disease. And so because we're not following patients forward in time to evaluate incidence of disease, we can't determine a relative risk, because a relative risk is really a ratio of the incidence of disease in one group to the incidence in another. So for this reason, the main outcome of a case control study is called an odds ratio, and the definition of an odds ratio is the odds of disease in the exposed group compared to the odds of disease in the unexposed group. And in the video on risk quantification, I talk about how to calculate risk ratios and odds ratios in more detail. So let's go through an example of a case control study. A group of 100 New Yorkers with lung cancer are identified based on a screening questionnaire. These patients are compared to another group that reported no lung cancer. Both groups were questioned about smoking within the past 10 years. The prevalence of smoking was 25% among lung cancer patients and 5% among non-lung cancer patients. So notice that the patients for the study are identified by whether or not they have lung cancer. They're being identified by the presence or absence of disease, and that's what you see in a case control study. So likely questions are: what type of study is this? The answer is case control. And what can be determined? The answer is an odds ratio. You should be aware that matching is very important in case control studies. Matching refers to selection of a control group that matches the patients with disease, and this is essential to get good study results. In a case control study, the controls should be as close as possible to the disease patients. Ideally, the only difference between the cases and the control groups should be the presence or absence of disease, not other things like age or gender or comorbid conditions. And this is necessary to limit confounding. If matching isn't done properly, then some other difference between the groups besides presence or absence of disease may explain the results. In the video on clinical trials, I talk about randomized clinical trials, and I just want to make a brief point here that you should be careful not to confuse randomized clinical trials with case control studies. In a clinical trial, patients are identified by disease, just like in a case control study. However, in a randomized trial, exposure is controlled by researchers and assigned randomly. And as I mentioned earlier in this video, what distinguishes epidemiology studies from clinical and research studies like randomized trials is that in epidemiology studies like case control studies, the researchers do not control exposure. So in your board exams, they are going to ask you to identify study types. So let's review how you do that now. Remember the key elements of the three different types of epidemiology studies. In a cross-sectional study, the study subjects are identified because they're members of a group, like we talked about earlier with New Yorkers. Exposure and outcome are assessed at the same time, and the study is just a snapshot in time, and cross-sectional studies allow you to determine prevalence of disease. In cohort studies, patients are selected by exposure status, and in these studies you can determine a risk ratio, and these are also called incidence studies because you can determine the incidence of disease. And then finally, in case control studies, patients are selected by disease status, whether they have disease or not, and the main outcome is an odds ratio. And that concludes our module on study designs.